Hello everyone, I'm Dr. Muhammad Hadi from Ayush Upskill Academy. Today's topic of discussion would be US healthcare structure. So as you already know that medical scribing is writing medical notes for the doctors situated in the US. So let us understand how the US healthcare structure works. Let us understand who are the players who contribute to the US healthcare. First of all, it is the primary care provider or PCP or physician. Number one, in the US, they tend to call all doctors as providers, okay, or physician, okay. These are the alternate names for the doctors. As you must be aware, I am not sure, the nurses also practice in the US, though they have a certain level of supervision of their doctors, but nurses can also practice. So a nurse or an MD or a physician, both can be a provider. Number one, so the first stakeholder of the US healthcare is provider. Number two is the patients, of course. Number three is the insurance companies. So this is the biggest change maker in the US healthcare. This is the biggest important element in the US healthcare. Unlike India, US healthcare is largely based on insurance systems. In India, what we do, if you fall sick, you directly go to the doctor of choice, you directly pay to the doctor, you get a prescription, you go to the pharmacy, you directly pay that pharmacy and collect medications. You use it and you decide whether you want to follow up a doctor or not, depending upon the situation. Or the doctor tells you when to follow, how to follow. But in the US, it doesn't happen like that. The patient does not need to pay the doctor directly, or the patient does not need to pay the pharmacy directly. There are instances where the patient needs to pay out of pocket in cases of co-pay. But for the larger part, for the sake of understanding, I'm telling you that patient does not pay to the physician directly. Then who does pay to the physicians for their service? It is the insurance company which paid to the physician. Okay, the patient goes to the doctor examines the patient, writes a prescription, the prescription goes to the pharmacy via internet, via a special system, via special software that is called EHR. The patient goes to the pharmacy, collects his medications. Okay, so how does it work? How the payment structure flows, how the doctors get paid, how the pharmacists get paid, we'll understand in the next 1 or 2 minutes. What is happening is the doctor writes prescription, the doctor writes notes for the patient. That particular medical note is the basis of doctor's payment. Okay, on the basis of that particular note, insurance company understands that what services the doctor has given to the patient. Okay, oh, the doctor has examined the patient, the doctor has asked patient's health, the doctor has treated his blood pressure, diabetes, whatever. There are certain dollar value attached to each and every thing which the doctor performs in the cabin. Okay, so you understand this medical note, writing medical note holds a huge value. It is not only a medical document, but it also a medical legal document. It is also used for billing purposes. So this medical note, writing of this medical note is outsourced to a country like India, where they find cheap services in terms of dollar. $1 becomes 80 rupees in India. So they are more than happy to outsource that service to India. And we have India advantage, of course. All of the Southeast Asian region, we Indians have good communication, good English, good understanding, good service track records. Okay, we see multiple patients, even basic level of doctor sees many patients of diabetes, hypertension. India is the diabetes capital, as we all know. So even the nurses, even the pharmacists, even the doctors in India are very smart. They see a lot of patients. They have good clinical knowledge. They have good clinical skills. That's why they outsource their work to India. This is called India advantage, friends. So medical scribing is writing medical note for the doctor situated in the US. So you understand how this business and how this skill can help you get a job in medical scribe. For more queries, you can follow my website, you can follow my WhatsApp group, you can come into my WhatsApp group, or you can come on the website and get benefit. Join my YouTube channel, like, share and subscribe to get more updates, more insightful videos like this. Thank you very much, friends.